Here we go. Welcome to the High River Healthcare Foundation social media. I'm Jody. Kathy's back, and wow, I feel like I just saw you.
It does feel like we just like we had a lot going on at the foundation these
Yeah,
days.
October is like crazy time for the foundation, and there's lots of moving parts, and we're excited that we're just 2 weeks away from the 34th annual dinner and auction.
Less
Sorry to
than.
remind you of that date this
Yeah.
morning,
And
but
there's
it's
not
going to
much
be
going
good.
on.
Yep,
Yeah.
50-50 cash raffle is on, and bidding started on Friday morning for the online auction. So lots of cool things are going on, but you and the team decided, you know what? We're going to add one more cool thing to October because we can. And I'm really excited about this. And I know the community is going to be really excited about this because when there's, I don't know, we love to support the foundation 365 days a year, but there's something special about when there's a huge project that comes into fruition and becomes something we can all rally behind. And there's been an incredible history of these projects happening with the foundation, including our incredible cancer clinic, our beautiful maternity ward, just to name two of many things. And so, Kathy, you get to tell us what the next one is today.
I do get to tell that. I am so thrilled. And Jody, I think part of the reason that it is so meaningful and because people like to get engaged and get involved is because it really is truly helping their friends, their families, and their community members when they're in the time of need and needing that extra care. So, without further ado, and I'll tell you, I am pretty passionate about this project. We are so excited to be launching our patient entertainment project, which will see us bringing 50 healthcare grade televisions to our acute care facility, our acute care units, along with up to 10 years of no fee service. So it's a great story how we got there, but we are just thrilled to be able to bring this service to our patients.
I think that's cool. And I feel like the key piece is that 10 years of no fee service added onto it because we don't think about lots of times the how things work in the background. You know what I mean?
Yeah, absolutely. That is the case. That is absolutely the case. In this way, there's no worry. It's in your room. You can turn it on if you want it. You can, you can not. So, but it's available. I think there's a great story of how we got to today.
Yeah, I'm
And
curious about
actually,
that.
yeah, Glenn Wolgard, a resident here in High River and a member of the Lions Club. Came into the office, or he was visiting someone at the hospital, and there was no TV in his room. And just to give people a little synopsis, some of the rooms have TVs, some of them don't. I don't know that they're 10 inches wide, unless they are. Some of the private rooms have larger TVs. Some of the TVs that are in there, I witnessed one. I was in one of the rooms, and the static and fuzz and the noise was unbearable. It's something we want to rectify. And so Glenn had been in and saw kind of, that his friend was down and out. There wasn't that distraction, and he came into the office and said, how do we make this happen? And so we are making it happen by partners like the Highwood Lions Club and the Hospital Auxiliary, who have joined us and have got us already to 25% of our fundraising target. And that target is $250,000. That includes the 50 medical healthcare grade televisions. And as we talked about, the 10 years installation, all of that, and the 10-year no fee service.
Yeah, I love this. Now, when you think about it, if you boil down to, I mean, you have a moment where you think of all the things that happen in a hospital and all the things that we've fundraised for in the past. And when you say TVs, you're kind of like, oh, I was thinking it was going to be some big, huge medical equipment piece. But the TVs are actually an integral piece of providing that beautiful care that happens. But I'm sure you can give us more story and background on like how important that really is while people are under care in the hospital.
Absolutely, it is. I think this is all part of patient family centered care, which we strive to deliver every day at the Harvard Hospital. And there's been observations that there's improved satisfaction, there's reduced anxiety, and it just creates a more positive experience. And it's And I can relate firsthand. It's a distraction, and it's something normal. If you watch Jeopardy and Wheel of Fortune every night, it's something you can continue to do. It's something to take your mind off of maybe the next test, or just that you're not feeling well. That distraction is huge. They become very long days in the hospital setting without those sorts of distractions. So just a huge piece of care, I believe. Like you said, it maybe
Yeah.
doesn't impact the medical, but sometimes the mental and emotional side is just as important.
Well, I would have to say it's probably as important because you have to be prepared for all of the levels. And think of how often, I just think of when you were saying that, how often at home, when we're just having a bad day or need to take a break, and how often we plunk down, we turn on a Netflix or a something,
Yeah.
and we just take that 20 minutes to recharge and kind of turn off the brain a little bit. And if you have that opportunity, in a time when there's a lot of other moving parts going on in your life, boy, that can make a huge amount of difference.
It sure can. Absolutely, Jody. Very well said. And just a little bit farther to how we got here. AHS has made the decision to move away from providing services. As we get into a more high tech way of delivering those sorts of things, but taking a look at our community, we recognize that we're not there yet. We're not in a hands. We don't. Our client, our residents and our patients aren't all at that hands-free kind of way of doing their technology yet,
Your
whether that be an
entertainment.
iPad
Yeah.
or their phone. And so when we looked at the community, we felt that this was what our community needed. This is what the patients needed, and this will take us to the 10 years, and then we can revisit it. And maybe we'll be at a time that you won't see TVs in the room because people are bringing in their own technology to stream or to watch whatever they choose to.
Well, and I think this is a perfect example of why our local foundation is so integral to keeping that care going in the community, because we're able to come together and assess, okay, what does our rural community hospital need the most that would help with the next level of patient care? And this is one of the things that comes to the table. And then we're able to make that happen and come to fruition on the time that works for the community. And I think that's just, it's like the shining example of why this foundation is so important in our community.
100%, Jody. The community saw the need, and now we are going out to the community to fill that need. And I have no doubt, especially based on like I said, our incredible start with the Ohio River Hospital Auxiliary and the Highwood Lines joining us already, that we'll get there.
Yeah. Okay. Now, in the past, when there's been these big community projects as you've rolled them out, there's been really cool, fun ways for the community to get involved to bring it to fruition. Now, one, of course, obvious is if you're attending the dinner and auction in a couple of weeks, funding from that night is going to help support this project. Or if you're bidding on the online auction, that kind of thing. But there's other cool ways that people can get involved. So tell us about those.
Absolutely. We are going to try something new that we've never tried. And those tip tap machines that I think probably, if we think back to the Poppy Fund, they probably, people might recognize those, where if you see one, we're going to partner with Colossi's and some of our other local businesses and have a tap machine, as well as in the hospital where you can just take your debit or credit card. I think debt credit card. I better figure out how it works. And you can
We got to
tap
go
it.
try tip tapping. Yeah.
You can tap it and make a quick donation. Colossus, you will see sleeves on their coffees coming out very soon with a QR code that will link you to our donation page and all of our information page. Obviously, you can come visit us or give us a call. We've created some pretty fun levels that people, if they want to engage in that way, we've got the audience level, which is $20 to $249. The game show level, which is $250. Hockey season level, which is $500, evening news level, which is $1,500, and that provides a TV for one room and the services for a year. So the producer level is $4,500, and that's 3 televisions and services. and a network level is 10,500, and that's 7 televisions and the services. So just some fun ways that people, think, oh, how can I get involved? And they want to do a TV or maybe a few, they can do that and just have a little fun with it. But contributions of any size will all go to getting us to our goal of raising $250,000 and bringing some great television service to our patients.
Well, and I think what's fun with this too is this is ways for businesses could challenge each other through it. Your friend groups could get together, different organizations or clubs could sort of challenge each other, whatever, like book club, or like whatever that looks like. You can kind of have some fun in putting that together for creating different fun levels. And I don't know, I think this is going to be so cool.
Yeah, I'm really excited, and I'm really excited to see how engaged the community becomes in this. It really, for anyone that's had someone in our facility as of late, I think most people will recognize that it is a bit frustrating, and that it is just missing. That is one piece that is missing, and so just thrilled to see it happen. This has been something I've kind of been passionate about for a number of years, and has kind of been on the back of the books for a long time. But like I said, it just took that community member coming in and say, how do we make it happen? And here we are.
You're like this is how we're going to do it. So, oh my gosh, this is going to be so fun. So if you would like to find out more information about the Patient Entertainment Project or any of the other cool things going on this month, visit our website, highriverhealthfoundation.ca. All the details are there. Or if you want to make a donation in support of this project right away, you can always call the office as well and make that donation happen. Right. I feel like we're on like a telephone. Make that donation happen now. Call now.
Our operators are waiting.
Yeah.
Rhonda's waiting.
Yeah. Rhonda's waiting. Right. You can be the first one to donate to it. Okay. Yes, try that out.
Absolutely.
I love it. Awesome. Okay. Let's raise some money. Let's get some TVs in there.
Let's bring Jeopardy to all those patients on third floor.
Right. Yeah. It's just, that's one of those shows that you feel like you leave it and you're like, I am so much smarter than a half an hour ago. I love it. So
I won't remember any of it, but
no,
for the moment,
random tidbits later. Yeah.
For the moment, I was smarter.
Awesome, Cathy. Thank you for joining us today. So excited for our Patient Entertainment Project, which kicks off as of today in our community. Looking forward to it. And we'll keep people updated on our social media channels, whether you're on Instagram or Facebook or YouTube, about where you can go and tip tap and have some fun in the community as we move forward. So stay tuned for more.
Stay tuned.
All right. Bye, everybody.
Bye, everybody. Thanks, Jody.